Hi, today I'm going to tell a story of a bladder healing that I had this week. As you might know, I've had pretty severe bladder problems this past year. I've had bladder problems the whole time I've been in a wheelchair, which is almost 6 years. And a year ago, when I was in the hospital for 20 days, they tried putting me on oxybutynin twice a day, which didn't help. I was still going to the bathroom every 1 to 2 hours, and basically that's kind of how it's been this past year. I could probably go a little bit longer if I didn't drink, like if I was out doing something and I didn't drink water the whole day, but 1 to 2 hours is pretty normal. And it was exhausting for me, back and forth to the toilet. The feeling that I would get would be that I would urinate, and it always seemed like I still had residual left in my bladder, so I constantly was thinking in the front of my mind, you know, where's the bathroom? How far am I away? It just, I couldn't even live my life. This past year, it's just even got to the point where I really couldn't even do anything comfortably, like have a long conversation with somebody without having to go to the bathroom, or I was thinking about it, not even really into what I was doing, always thinking about my bladder. Well, over 2 weeks ago, I saw my doctor, and he increased my medication. I had been on the oxybutynin extended release, which you take once a day, 10 milligrams. Well, he increased it to 2 times a day. And I was on that for about 5 days and had some severe side effects, mainly dry mouth, weakness, and retention. And so there was times where I wouldn't be able to go to the bathroom, and then I would have an accident. This year I've had lots of accidents. I peed my bed, I've peed my chair many times. Sometimes it's when I'm actually in the bathroom and I'm just too spastic to transfer, and I just wet my chair. And so this last week, when I started having more problems, my caregiver bought me some like strap-on Depends absorbent pads, and so I was just emotionally really scared, because having incontinence issues at the age of 43 really scared me, because I thought that I was going to probably end up in a nursing home, because when you're disabled in a wheelchair and having incontinence and problems and weakness, that's basically where you would go if you were to, get into the field of not taking care of yourself anymore. So I've had a lot of fear in my life this last 6 months because of my incontinence issues. Sorry, this video might be kind of long, but I have to explain. Anyway, after having the retention for several days, one time I had 13 hours where I didn't go to the bathroom, and I ended up talking to a nurse that was a urology nurse, and she explained to me that they never prescribe the oxybutynin extended release for this reason only, because having side effects, they're so long lasting. And so I went off the medication a week ago, yesterday. So what had happened was I got a little vacation from my bladder problems. I'd had more retention last weekend, and on Sunday I ended up in the emergency room because I just had no feeling like I even needed to go at all. It was, in a way, kind of fun and nice but I was definitely keeping an eye on it, and the emergency room doctor was even considering installing a Foley catheter, and the nurse at the MS clinic was saying that, yeah, maybe you need to get a catheter, and that was a huge fear for me, and anyway, it turned out that we did an ultrasound of my kidneys, and everything was normal, and he assured me that my bladder wasn't like ready to burst or anything because I hadn't been drinking. So, I just basically decided to drink a big iced latte, and then I started going pee again. So, as this week has progressed, my bladder is almost normal. I've been going like 5-6 hours at night without having to go. And the only reason I do go is because I'm kind of up and checking. During the day, it's like I've been given my life back. I can do things for 2-3 hours, 4 or 5 hours without having to go pee. And when I go pee, it's like a steady stream. It's like I'm normal. And the thing about the medication is I've been having bladder problems for much longer than I've been on this medication, and so in a way I feel like I've actually been healed of my bladder problems. Now, granted, it's only been a week and it could come back, but this past week I've been given my life back, and I also have been having bowel movements by myself because the medicine does cause constipation. But I've been on a bowel program for over 6 years, so I've had constipation issues for much, much longer than I was on this medicine too. So the whole thing seemed kind of ironic because last Saturday, the day before I went into the emergency room, I had a conversation with my sister, and we were talking about faith, and I have really strong faith in God, and I have for years, but this last 6 months, I guess I really have almost given up my faith, and really figured, well, this is just the way it's going to be, and I'm going to probably end up spiraling into this, shitty place of losing my independence and having to frickin' wear diapers. And I was so pissed. And, not only that, but I have chronic pain and spasticity. And my muscles, I've found out that they fire even at rest. I mean, if you could just look at I'm solid muscle. I mean, I'm not really skinny because I am skinny, but I'm this way because my muscles are burning calories without even me doing anything. And I wanted to kind of show the little before video. My left arm, I've got frozen shoulder, so I can only raise it about this high, and then my right arm, I can raise this high. And so this is kind of, in a way, a before video, but I actually feel that I was blessed with a healing before CCSVI. And to top it off, I got another little encouraging thing. I've got a financial blessing of about $1,900 this week, which was totally unexpected, and I can use towards my caregiving help and some other things that I want to do around my house. So, geez, this week, right before my CCSVI, I've been given a head start, and I just wanted to share that with everybody. And, you know, I'm not saying that people should try coming off the bladder medication, but for me, it gave me my life back, and, you know, it was so worth it. I just didn't even want to get a catheter. Anyway, that's it. Thanks, guys. I'll talk to you later.